Okay. Welcome to Fat Mascara. We're going to hear a thoughtful take on beauty culture, and we're going to unfilter the beauty industry. I'm Jen Sullivan. This episode is a listener request, a multiple listener request. A lot of you have been messaging us about non-surgical facelifts, wanting to know what they are and how they work. But at the same time, I'm always out there interviewing dermatologists and plastic surgeons. And I've been hearing more and more from them about how we're at this point in time where non-surgical cosmetic enhancements like neurotoxins, fillers, lasers, they've been available for almost 30 years. So people who have been getting them for decades might now be at that point where they're wanting to do something more invasive like a facelift. Well, how do all those non-surgical treatments affect the results of a facelift down the line? And also, what if you can't afford any of this stuff or you don't want any of this stuff? Does skincare make a difference? And if so, what skincare? So, to help me get to the bottom of all of this, facial plastic and reconstructive surgeon Dr. Kimberly Lee is here. So she's a graduate of Stanford Medical School. Side note, as I was researching this episode, did you know that this medical school only accepts 1% of the people who apply? Stanford? I did not know that. Anyway, so of course, Dr. Lee is, NBD. She's an assistant clinical professor in the Division of Head and Neck Surgery at Cedars-Sinai Medical Center. She's also the residing director of the Beverly Hills Facial Plastic Surgery Center. She's been a national trainer and educator for non-invasive cosmetic injectables, so she knows all about that. She's someone who does both surgical and non-surgical cosmetic work every day. So that's what makes her the perfect person for this special episode. Let's get into it. Okay, Dr. Lee, welcome to Fat Mascara. How are you?
I'm good. Thanks so much for inviting me to your show.
I am so excited for this episode because this topic is in demand. Your expertise is in demand.
Well, that's great to know.
Maybe everybody doesn't know what your expertise is. I do because I do my pre-interview research, but let's talk about what you do first. Tell me about your practice and who your patients are. What do you focus on?
Sure. So I'm a board-certified facial plastic surgeon, which means that I focus primarily from the clavicles up. So it's your face, your ears, your nose, your neck. That's my area of specialty. I've always wanted to do something with my hands, and I loved seeing the fruits of my labor. So surgery was a natural extension or course for me. But I had this really unique event that happened when I was a resident, and I had a woman whose face was mauled by a bear. She was helicoptered into UCLA Hospital, and at the time, I was the lead surgeon for this case because it was an emergency and not everyone was available. I put this lady back not knowing what she looked like, and I was really just so terrified that the following morning when she woke up, that she would say something like, "Why did you fix me up? You should have just let me die." So I was really terrified about that. Didn't know what she looked like, didn't know what her expectations were, didn't get an opportunity to really have a conversation with her before surgery. But to my surprise, she was ecstatic the next morning. And her face has been fixed, so you can't even tell that she's been attacked by a bear, and she healed beautifully. So that was a really
wonderful and rewarding.
It's a very rewarding experience. It's one of the reasons why we go into surgery, why we go into medicine, because I know this is a little bit cliched, but we really do want to help patients. And so after this experience, this is what really led me in this path of doing facial plastic and reconstructive surgery. So my private practice is focused primarily on, I would say the majority is cosmetic facial plastic surgery, but also there is a reconstructive portion. And a lot of cases, whether it's the nose, there's a functional aspect and a cosmetic aspect, which is nice to be able to do both to help the patients.
Yeah, and not just that. The reason I also want to talk to you is you've brought into your practice, because you do focus on aesthetics a little bit, the other things in addition to surgical changes like injectables and all of the things that people can now do for medical reasons, for aesthetic reasons to change their face, right? You're not just a surgeon.
Correct. And I think that that shift in paradigm has really happened over the last 10 years, where traditionally it was always you only had surgical options and there weren't many non-surgical options. But now we have a whole smattering of injectables, non-invasive procedures, and we've really become so technologically advanced to offer all of these different technologies to help patients really feel great about themselves.
Yeah, but with that 10 years, I think has also come like the media and social media makes it seem like we're going shopping for both features and also procedures because we see all of this stuff, we're learning more about it. And I feel like at certain points, you stop thinking about your face as like your face and you start thinking about like, do I need this nose? Should I have this injectable? Should I get this lift? You
Right.
know what I mean?
I totally understand. And I think when it comes to aesthetics of the face, and given the choices that we have today, I think it's really important that we approach it with a mindset of self expression and personal enhancement as opposed to perfection. And you're right, social media and media often present options or choices as sort of shopping for features or procedures. And I think it's really crucial to focus on what genuinely makes us feel confident about ourselves, but also true to ourselves and our ethnic background. So while we have these options that allow us to embrace our individuality and enhance our natural beauty, we want these to align with our personal values and goals. So I always tell patients that it's important to enhance your unique features and make choices that support our overall well-being as opposed to conforming to trends or fads or external pressures.
I mean, that's great advice. It's easy to say, and sometimes it feels hard to do. I'm
Yeah,
sure you know.
sure.
But I think the reason that I really wanted to talk to you is because I have gotten so many questions. People will send me, like, have you heard of this thing or that thing? And a lot of doctors market their work now with specific names. But what I noticed a theme of was surgical versus non-surgical, like doctors calling things a non-surgical facelift or like an injectable. And people, they want to make a change, but not knowing, is this a surgery or is this a thing that I go at lunchtime and get? So I want to dig into that. But do you think about things that way when a patient comes to you? Are you like, okay, they are a surgery patient or they're not? Or how do you approach that
Well,
discussion?
so I have a slightly different approach to my patients. Being female myself, I really put myself in the patient's shoes. So I really want to get to the what is it that you're hoping I could do for you? What is it that you're trying to achieve? And it's really important to understand where that patient's goals are. And then my job is to help them reach those goals. So, for example, I think the traditional thought is for a surgical facelift, oh, well, that's something my grandmother would do, right? But that's not really the case now because back in the day, we were talking about correction. You get older, you don't really like the way you look in the mirror, you feel super young inside. And so we want the outside to match our inside. So we're doing corrective surgery. We're trying to correct the signs of aging. Our thinking has shifted, and that I see younger people coming in and that they want to do preventative treatment. So they don't want to look old and then look young again. They want to always look like they do now, and they want to keep
Lock themselves in time at whatever
Exactly.
age they come to you.
That's
Okay.
exactly right. And so I think it really depends on the patient's goals. So some people are deathly terrified of anything surgical. And for those patients, you have to approach it, well, these are your options. You have surgical options, you have non-surgical options. Non-surgical options always are much more popular with the younger population because it's less invasive, less recovery time is needed, and it's generally less expensive. So that for those three reasons, it's much more popular. However, from the physician standpoint, we're thinking about results. And let me give you kind of an extreme example. If you were 95 years old and you had all this sagging skin and you never did anything to your face in your entire lifetime, and you came in and you said, I'd like to get a little bit of Botox to look younger. Well, yes, there's a point in place for Botox in your face because it helps relax some of these lines. But would you get a far better result with surgery? Of course, because the Botox and fillers will only do so much. So everything is customized to the person's face, what their goals are, and the results that they're seeking. Because I'm trying to get you to where you're trying to go. And I think it's sometimes hard when a patient comes in and says, I only want one syringe of filler, but I want to do 5 areas. And it's like, okay, well, that's not really going to achieve a whole lot. And in those cases, I go through the consultation. I educate the patient on what the syringe filler can do for you. But realistically, you're not going to be able to address all 5 areas. And in some cases, I tell the patient, you know what, it's just better to save your money and come back later so you can do this properly. Otherwise, you won't see any result.
So I want to dig into that little bit of a decision that people have to make because I
Yes.
think it's scary. First of all, money reasons, a lot of people are never going to be able to get either surgery or non-invasive.
Sure.
Also, time reasons, they're like, am I really ready to go sit in your office and have that consultation? So, like, maybe they're listening and they're in research mode, if you know what
Yes.
I mean.
Yes.
So, something that I think came up a lot was this idea of, I don't know why we're calling it now, but a non-surgical facelift.
Mhm.
What does that mean to you as a doctor? Does that mean anything?
Well, it means a lot of things, and it can mean a lot of different things to a lot of different people. But basically, when somebody comes in saying that to me, I'm thinking, okay, this is a person who wants to look younger without having surgical intervention. That's what that means to me. And I delve in and I spend the time to ask the patient, what is it that you're trying to do? What have you researched and what are you thinking about doing? Because I think it's really important to really understand where each patient is coming from. Everybody has different goals and they have different results that they're seeking. They have different facial anatomy. So what might work for one person may not be the best option for somebody else.
So they say they want to look refreshed or whatever. For some people, that might be, oh, okay, your eyes are hollow, you need a little filler. For another person, their jowls are sagging. Like
Correct.
you have to see the face is what
You
I'm
have
hearing.
to see the face. That's right. And non-surgical can encompass, radiofrequency treatments. It could be dermal fillers. It could be Botox. It could be a whole slew of things. So it doesn't necessarily refer to one thing. In the past, when we didn't have all these other options, non-surgical facelift meant facelift with fillers and dermal fillers. But as we've expanded our technological offerings and as we expanded all the options that are available, that doesn't necessarily mean that. So you really have to understand from the patient what it is they're hoping to achieve.
You know why I think it sounds so popular? Because I've seen a lot of doctors market this idea and they give it like a general price and they're like, it's easy. And in my head, I'm like, are they really just doing the same, a thread lift, radio frequency, and Botox on everyone? Probably not, right? Once they get them in the office, they're not everybody's going to get the same 1, 2, 3, right?
Correct. That's absolutely correct. You can't, with faces, especially with faces, it's not that clear cut because everybody's facial anatomy is
Okay.
different, right? If you're female versus male, we have different features. It's not one surgery fits all. And I think that's so important to understand. And I get this sometimes where a patient comes in and they go, oh, okay, I really like Maggie Q's nose. I want her nose. And I go, great.
Oh, does Mackie Q have a good nose? I can't picture it right now.
She does. It works for her
Okay.
face. She looks beautiful. So then I sort of cover up the other parts of her face and I go, okay, what is it about her nose that you like? And sometimes patients will say, actually, I don't think that would really fit my face. And it's a really important aha moment for patients because you have to understand that what works for this person may not fit for your face. It works for them. They look beautiful. But on you, you have different features, different proportions. And so it's about achieving balance for your face.
I know this is going to feel a little facelifty 101, and this is what I write about, so I know this, but I think some of our listeners, you named a whole bunch of different therapies all at once when we were talking about non-surgical facelift.
Yes.
So can you just take me through the broad categories of families of things that refresh a face but aren't quite surgery? Maybe we start with like the injectables, right?
Sure. So injectables would include things like Botox or neurotoxins. Those are injectables that will help relax muscles. And when these muscles contract, they create wrinkles. So think about your frown lines. When you're starting to frown, you get these 11 lines in between your eyebrows. You don't see them when you're at rest, but you see them when you're frowning. And that's what Botox or other types of neurotoxins, such as Dysport, can help soften. Other types of injectables are fillers. So that's the next major category. And think of it as something that's going to fill up or revolumize areas of your face. As we get older, unfortunately, we all start to sag and lose some volume. The first area that we see this is underneath the eyes. We start getting some tear trough. And then we start getting these nasolabial folds or these deep smile lines. Those tend to get deeper as we get older. Then we start seeing kind of the corners of our mouth turn downward, and we get these lines called marionette lines or puppet lines. And then we get these jowls that don't give us that straight jawline anymore. And I always tell patients, let's think of ourselves as a young, plump grape. When we're young, we're this full, plump grape. As we get older, we sort of turn into shriveled raisins. But you don't just cut out the skin of the raisin and expect to be that plump grape anymore. You've got to revolumize yourself. Maybe we remove some skin too, but you want to revolumize and become that plump grape again. That's what gives you that youthful appearance. So dermal fillers are thought to be an injectable, so we use a needle. We inject this usually hyaluronic acid-based filler to then revolumize areas of depression or indentation in our face.
Yeah. You also mentioned radiofrequency.
Yes. So radiofrequency is an advanced type of technology that helps to tighten the dermal plexus. There's a couple of different ways that we use this. So there's an internal type where we use almost like a probe, which is really not much thicker than a needle. It goes underneath your skin. It tightens the dermal plexus or the undersurface of the skin to then tighten the skin. We're not cutting out skin. There's no cutting involved, but it helps to tighten the skin. We can also use it on the outside of the skin to help smoothen out some fine lines and wrinkles. But anything that's not super invasive, you just need a lot more patience for. That's what I usually tell my patients.
The way that people hear about these are usually with brand names. Are these things
Yes.
like Morpheus or Ulthera? Like, what are the brand names
Right.
that you might hear when you talk about?
So Thermi is a big one. Morpheus is using radiofrequency. They also use microneedling. They combine that. You may have heard of some ultrasonic treatments, which is like Ultherapy. That's a different type of technology.
Not radiofrequency.
Not radiofrequency. It uses ultrasound. But there are a lot of different types of machines on the market. The next sort of category would be lasers. So that's really common, right? But there's 10 million different lasers on the market. So lasers are dictated by their wavelength. And depending on what you're trying to treat, if it's just fine lines and wrinkles or you're trying to resurface the outer texture of your skin, that's going to be a type of laser versus somebody who has acne scars, which are deep scars. That's going to be a slightly different type of laser or wavelength, I should say.
I feel like we hit a lot of the big non-surgical categories. You didn't mention threads.
Threads are huge. And I would say in the past, maybe 20 years ago, they weren't so great. They are very advanced now, and they are
Really?
very
Okay.
popular. Okay.
So what are facial threads? Yeah.
The best way that I can sort of describe this is when we do surgery, we use different types of sutures. They come in absorbable or dissolvable kinds, and they have permanent types of sutures. They've used the threads, and they've manufactured threads that have barbs in them. So they are dissolvable suture-like material that have threads or barbs that then tunnel under the skin, and they suspend the skin up. So they're great when they're trying to lift sagging skin or sagging areas in your face, such as when you start getting deep smile lines or kind of these jowls, they will help lift that skin. The downside to this is that these threads dissolve and they're gone in about 6 or 9 months. The results last about a year, maybe a year and a half, but you're still aging. And so whether or not you got the threads a year ago, your face is a little bit older or it's a little bit more sagging than it was a year ago. So you've got to repeat this. It's a little bit more it's longer lasting than fillers, but it's more temporary than something surgical. The nice thing is that
it's not surgical, right?
It's not surgical. That's right.
Yeah.
You're awake. It's like a needle poke, just like you would get a blood draw from your arm. We do a couple of needle pokes, put the threads in, it suspends. You'll see the results pretty much right away, and you go home the same day.
So I think people get to a point where they're like, okay, that probably sounds like something I want. Let's say I need to lift a little. I'm getting a little jowly, but just a little. I don't want a facelift.
Right.
But they have to make this decision of like, if I make a choice now that's non-surgical, am I just putting off the inevitable? Do you ever hear that from patients?
Well, I think, yes. I mean, we're all putting off the inevitable, right? I think we all age, unfortunately. Whether it's you, me, or anyone else, we're all aging. And so we can't really stop that process. So whatever you're doing now, I mean, it's really a matter of what kind of result am I looking for? What is the longevity of the result that I'm looking for? So a lot of times people will do fillers and that will be their first step, Botox and fillers. But there's a limit as to how many fillers you can really get in your face because you don't want to look like a balloon either. And so then the next step would be the threads. You may do some threads and some fillers just to kind of put icing on the cake. And then the next step after that would be something maybe more surgical. And you've gotten more confidence usually in each of these steps as you go along.
And who has more confidence, you, the practitioner, or me, the patient?
You, the patient.
Oh, okay. Do you mean to say, like, have you noticed that as someone gets older, if they've been getting these things, they worry less about their...
Absolutely.
They do.
Well, they're less worried about having a procedure done. The patient who's never done anything.
Oh, they're like baby stepping
They're
their way
baby steps. Exactly. So the patient who's never done anything, they come in and they're terrified of Botox, just absolutely terrified. And that's totally fine. I have no problem with that. I was a national trainer for many years for Botox and fillers. And my stance on this is I'm here for you if you're ready. I'm not going to push you to do anything that you don't feel comfortable doing. We'll just take baby steps. And I have these patients, and I remember them. They come in, they're so terrified of doing Botox. Then after a couple of sessions, they're like, oh, yes, I'm ready. I want to do all these other areas. And then they want to do something else. And then and that's totally fine. And that's a normal progression, right? And then you have other patients who are like, you know what? I know I need to do something surgical. That's why I'm here. My grandmother had a facelift. My mother had a facelift. And I just want to stay the way I am now. I want to look the way I do. I don't want to look too crazy. I don't want to get too old and have to correct the signs of aging. So I just kind of want to look like I am now in about 10 years. And they're ready for surgery. But that's not everybody. So everybody is unique. They have different opinions about some of these options and different levels of comfort. So it's really about giving a customized treatment for the patient at the level that they're comfortable with.
I think it's interesting that we are, I would say, 30 years into being able to do any of this non-surgical stuff, right? So we're at this inflection point I've heard about from other doctors where people who say let's say they're 60 and they're sort of at the point, like, maybe I want to do something surgical. But this might be a patient who now has been getting fillers and getting neurotoxin, maybe some of these other things for years. You as a doctor 20 years ago would never see a patient like that, right? Those faces wouldn't be in your office. So I feel like you guys are at this point where you have to learn about doing facial surgery on a different kind of face than you're used to. Is that right?
That's absolutely right. And I think it's sometimes the patients don't remember what they look like without the fillers either.
Also, I don't even know what's in my face at this point because I've gone to doctors. I let them do their thing. Like, I don't have a medical history of like blah, blah, cc's of sculpture back in 19, So how do you approach this now?
So a lot of times patients can remember, I've had my laugh lines injected or whatnot, and we can feel them. I usually recommend dissolving any fillers before having any surgical intervention.
Why? I'm fascinated by this.
Because let's think about this for a second. So let's say you had fillers in your cheeks and your laugh lines, and we went and did surgery and left that alone. Well, you may look great right afterwards, but as that filler goes away gradually, your face is going to change and you're not going to be as happy because it's not going to be as full.
This is so simplistic in my mind, like you didn't pull tight enough because the filler was in the way. But
that's what some patients might think, but that's why it's really important before surgery to have this conversation and say, you know what, you've had filler in here, it will change, let's get it dissolved. I usually recommend that we inject with fat. We liposuction fat from you. We inject that and use it kind of like a filler, which is a little bit more longer lasting. Sometimes if the patient really can't remember, then we can use imaging and try to identify areas which may have fillers.
Now, what kind of imaging?
Ultrasound. Ultrasound is usually easiest, and they can sort of determine based on what they see, if there's any filler left in some of these areas.
That you send them in for that, and then you sort of get like a map of their face of like where the filler is before you even make a cut or make a recommendation?
Yes, I don't always do this. This would be sort of a little bit more of a unique situation, but I have done this in patients before.
But don't you think going forward you're going to be doing it more because we all got stuff in our face? The kind of person that's coming to you for a facelift.
Right.
You know what I mean?
So I typically, most patients do know where they've gotten filler. And you can kind of feel it a little bit. So we'll inject dissolvent in those areas. But this would be more for the patient who has no clue. Now, if they've had something like Sculptra, that's not really reversible.
It's because it is not HA filler. It's a
HA,
different kind of
correct.
filler.
That's
So
right.
would you also see that on imaging?
It would be a little bit different because the way that Sculptra works is that it really induces your own body to create your own collagen. So that's a little bit different as opposed to a filler, which we know is going to get metabolized and go away. That's a little bit different.
First, before we talk about long-term effects of some of these non-surgical things, I'm curious, have you ever started a surgery and been surprised by something in a patient's face, like a cosmetic surgery?
Well, me and most surgeons, we don't like a lot of surprises when we're in surgery. I'll tell you
Yeah, I
that.
imagine.
So for me, I spend quite a bit of time with each patient before we go to surgery. We meet with them several times. We go over the surgical plan. We go over all of these kind of what ifs, because I don't really like surprises in surgery, but that doesn't mean I don't get them. And you're right. Sometimes there's something that I didn't anticipate. I can think of several instances where a patient had threads back in the day before they were even threads. They were just sort of sutures that were placed kind of like a thread. And the patient forgot about it. They didn't know. And then you get in there for surgery and you see, oh, okay, well, yeah, I see what they did here. And that's fine. It's just that's why it's so critical before any surgery that I have that time and go in depth with each patient as to what they're hoping to achieve. Because a lot of times, especially with revision surgeries, I always tell patients up front, all bets are off. I don't know what I'm going to find until I get in there. But I need to understand where your goals are because I have to make those intraoperative decisions and get you there.
I don't know if this is a myth or a rumor, but some people doctors talking about the quality of the skin being compromised because of particular procedures they might have had. Maybe they had filler and it stretched the skin. Maybe they had years of retinol and it was thinned. The one I hear about is microcoring. You know, those, it's like they take the teeny little core. What's the brand name of it? You know what I'm talking about.
Citrellus
Is one of them. Yeah.
is one of them. There's about 4 of them on the market, I think.
Basically, but correct me if I'm wrong, it pokes out a little tiny core you can barely see, collagen kicks in, plumps you up. But I've heard doctors say patients who've had this, their skin just is different than later on in life than someone who hasn't. Is that true?
So I can't speak specifically about that, but what I can tell you is when we think about skin and we think about how skin heals, whenever we make an incision or you get a cut or you have some sort of trauma, you get hurt, when that skin heals, it's never going to be 100% as strong. It will only ever be 80% as strong as it once was. And so when they're coring out small pieces of skin that you really can't see, maybe what they're referring to is the tensile strength of that skin because now that's been changed because some of those little pieces are now gone.
And so their surgical techniques, a good surgeon would adjust for that is how it would work?
Yes, but I think it's more important to have that conversation up front with the patient and tell them these are some of the challenges that we may encounter because it's all about you as a patient. If I put myself in the patient's shoes, I kind of want to know all of this, right? I want to know that this might happen or that might happen and some of the risks that are involved.
Yeah.
Because I think it's really important when you're about to undergo a procedure that you as a patient don't do all the time. We as surgeons do. It's helpful to have these conversations. And oftentimes I spend a lot of time with patients. It's all written in informed consents and whatnot, but I also like to have that conversation with patients, especially for some of these unique situations.
Yeah. I think the reason I'm asking is not just for you when you're doing surgery, but some people when they're making these decisions and they're deciding on non-surgical things, they might hear, like, people are getting Botox so much younger than it was originally thought and FDA approved, and they're doing off-label usages. And so just talking about long-term effects of some of these non-surgical things, whether or not they decide to have surgery down the line, like with neurotoxins, can you do any damage or just something negative that you wouldn't want if you keep doing neurotoxins for 20, 30 years?
So I think the challenge with getting Botox for that long is some of the potential effects of tolerance or resistance. So meaning, let's say you've been getting Botox for 20 years in between your eyebrows, and now you're finding that it either doesn't last as long, or you're finding that you need more Botox to achieve the same results. I think some of those are some of the long-term effects of getting repeated Botox. And so when I have a patient who's on the younger side, I try to underdose a little bit. I try to give the smallest amount of Botox that I could do to get them to get the result that they're looking for, because I know that this patient is probably going to be using Botox for a long time moving forward. So you could achieve the same result whether you're giving a bigger dose, but I want to give the smallest dose possible when they're young. This is a common concern with everything that we have, right? Most people don't think about long-term effects. Like a common one with threads is if you do threads now, oh, I look great and I look great for a year. It's not really invasive, not as expensive as surgery. So that seems like a no-brainer to me. And they do this, but they don't realize that as that collagen is taking effect, if you decide to do a facelift later in life, it's a lot harder for us as surgeons because now we're trying to get through some of this tissue, which is almost like scar tissue. So it makes that surgery a little bit harder for us.
Yeah. I feel like everybody listening wants the sweet spot of like, I did just the right amount, but then I still have in my back pocket the facelift someday if I need it.
Right.
But because people are doing these things younger and we haven't yet seen, I mean, they've only had cosmetic Botox and neurotoxins for not that long. We don't know what people are going to look like as they age with all this stuff in their face.
We don't really know. That's the real
That's
answer.
crazy.
We don't really know. We don't really know. But that's science, right? We don't really know anything until we've done all these clinical studies and papers for decades out.
Well, okay, so let's talk about filler. We talked about some of the long-term effects of neurotoxin. Filler is one of those things, a little bit scarier maybe for some people because you're putting a thing in your face and they hear like, maybe it doesn't dissolve the way it was supposed to in 6 months, or it migrates. Talk to me about these like long-term things you hear when patients come in asking questions about them.
Right. Well, there's definitely some additional risks when it comes to fillers. So when it comes to fillers, I really strongly encourage patients to do their research because the filler is only as good as the person injecting you with them. So it's really important to seek an expert injector. You don't want to go to the guy in the back alley injecting who knows what into your face, okay? So I always tell patients that. And this is not like you go to Neiman Marcus and you buy the shirt and it's the same shirt at Ross. It's the same brand and everything. It's not quite like that. So when it comes to these injectables, this is different. This is not a commodity, okay? It's about the person actually injecting you because there are some risks with some of these injectables. So that's like the first, if you take away nothing from this podcast, please, 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 this is like the most important thing. Just because it's a needle doesn't mean it's so easy. Okay. I think sometimes people think, well, when I was a kid, I got these immunization shots and it was just like anyone doing it. It's very different from that because you really have to understand the anatomy and we have to understand where this filler is going into. So a couple of the questions you were asking were that sometimes they don't dissolve or metabolize as fast as you would like. When you want it to stay forever, it seems to go away faster. And when you want it to go away, it seems to last forever. I mean, that's that's kind of what most people feel. But around the mouth, anecdotally, I feel that it goes away a little bit faster because we do animate and talk and have facial expression. So that makes sense that some of the fillers in the laugh lines would get metabolized a little bit faster. In other areas, temples, kind of in the malar area, we find that they may last a little bit longer just because we don't use those areas as much. Now, fillers have become very sophisticated over the last 5 or 10 years in that we used to only have 2 or 3 different types of fillers. Now we have a whole smattering of fillers. They have different properties.
And even if they're hyaluronic acid, there's different cross-linking and different types of hyaluronic and different viscosities.
That's right.
And
Exactly. So they've become very sophisticated, which means for the consumer, you look a lot more natural. You don't see a filler sitting in your laugh line when you're trying to talk. It's going to be a little bit more pliable. So some of the fillers, they'll have some elasticity. So when you talk, you don't really see that there's a filler there. So I think there are ways that we can dissolve filler with the hyaluronidase, which is an enzyme that's specific for the hyaluronic acid filler. It will dissolve that. You asked about migration. So whenever we inject filler, every filler is what we call hydrophilic, meaning it attracts water. And what that means for you is that you're going to have swelling for about 3 days. That's what that means. I always tell patients, especially patients who've never done this before, they want to get it done right before a big event. It's like, please don't do that. Come in like 2 or 3 weeks before a big event. I usually say a month because you could get bruised. You may need a little tweaking or whatnot. So it's always best to come in kind of on the earlier side. In terms of migration, I feel like fillers, while they're injected, there's still some movement or ability to move in the first 2 weeks. And the best way I can describe this to you is, let's say we did filler in your laugh lines, and then you went and you got this deep facial massage. Well, with the amount of pressure that they use in their fingers kind of doing this massage, it could move the filler. So you just want to be really careful in the first several weeks after that injection.
Yeah. I feel like people love picking apart a picture of either a celebrity or somebody's work online, and they're like, look what happened here. What do you think when you see those accounts where they do that? Are they ever right?
I try not to look at those accounts in the first place, but I think that a lot of this has to do with, again, the patient's goals. So everything's customized. There's
Yeah.
no one treatment fits everybody. That's not reality. And I don't think you should think of it that way because everyone looks different. So it's really what is going to enhance this person, or what is it that they're looking to achieve? And sometimes it's our job to tell the patient, you know what, I think you're good. You don't need more filler.
Yeah.
Because I prefer a natural appearance. I'm female myself. I kind of really prefer, and my philosophy is really that I want you to look very natural, and I
Yeah.
don't really want you to look like you've had something done. But yes, of course, you look better and you're more enhanced in some of these areas of concern. Now, everybody has those 1 or 2 areas about themselves that they don't like. Everybody has this. Whether or not somebody else notices it is a different story. But we all have that 1 or 2 areas. So if that makes you feel better, sure, we can address it. But I don't really want you to look so different or dramatic or really unnatural. I don't think that that's usually a desired look.
Yeah. The kind of work you're talking about, I found, is the expensive kind, because the better the practitioner, the more they charge. And it becomes like a question of privilege a lot, because a lot of people listening are like, I am never going to have the money, A, for injectables, B, for surgery, or maybe they're just like, I don't know, if I spend all this money on injectables now, I wouldn't have money later to do other things I want. Do you think there are other ways to sort of lock in that age you're at, or age gracefully, that aren't surgical or that aren't like non-surgical? Like, does skincare really make a difference?
So it's a great question. I think those are really valid points. And I always tell patients, if you can't afford something, sometimes it's better to just save your money and do it right. Because what happens is, when you try to cut corners, especially in our field, let's say you go to somebody who's a third of the cost or half of the cost. There's a reason. And in our field, you get what you pay for, right? So, and I've seen this before where we had this patient came in for a second opinion. She had been injected with fillers to save a little bit of money. She had this done by somebody who was, I don't know who she went to, but it was basically not an FDA approved filler. It was like a fake filler.
Okay.
The box that she described was not the same color as any of our major manufacturers. And so I'm not exactly sure what she was injected with, but unfortunately they got into a blood vessel and she ended up with some permanent, not irreversible consequences.
Mhm.
And so then you start asking yourself, is it worth it? I saved $50, but now I have some permanent irreversible changes on my face. It's usually not worth it. So I always tell patients, just save your money, just do it right. Yes, It does cost more, but you're also trying to avoid a lot of these problems or risks or complications that can potentially happen in somebody who's not as skilled of an injector.
So easy to say, but then a regular person who maybe does not have discretionary income to pay for these things goes online and it looks like everybody's getting it done and it looks like it's no big deal. And so you want to be part of it. Like we've created this world where like you think you should have access. And you should like, it's just become so classist in a way to me, you
Right.
know? That's why I ask about skincare, because that's something that like, it doesn't have to be expensive to like get skincare. Do you think it will make a difference in the long run if someone has a good skincare routine?
Well, I think skincare is always a very important part of our beauty regimen because the skin is the largest organ in our bodies. And so taking care of the skin that you have is always critical. I always feel like when you're 15 or 20 years old, you could use any skincare and you would look fabulous. But as we get older, that's not necessarily the case. And we need some additional sort of ingredients or additional enhancements or additional treatments to help address some of the issues that maturing skin can have, which is, things like fine lines and wrinkles or hyperpigmentation spots. I mean, these are all a little bit more specialty or a little bit more targeted areas that we need some additional help for. But I think when you're younger, yes, of course. I mean, you should have good skincare and you'll get more benefit from it just because.
What does good skincare mean to you? Like sunscreen, non-negotiable, right?
Sunscreen, non-negotiable. Sunscreen comes in 2 categories. I don't think everybody knows this.
Fat Mascara listeners know.
You
As
know.
We're going to get
Okay.
into our chemical
Okay, so there's chemical, there's physical base. I always recommend physical base, right? So it creates a barrier so the UVA and UVB rays can't penetrate your skin. Okay, so that's non-negotiable.
Physical sunscreen, okay.
Physical sunscreen. I think good skincare to me isn't skincare that smells great and feels great. This is something that's going to have some active ingredients to help you get results. That's what I'm talking about. So legally, the department stores cannot sell you something that has a whole lot of active ingredients. Now, when you're 15 or 20 or 25, you may not need all of these active ingredients, but I'm talking about things such as a little bit of retinol or a little bit of hydroquinone to brighten your face. These are more prescription-based skincares. So if you have targeted needs, something over the counter may or may not get you the result that you're looking for. So that's why you always want to go see a facial plastic surgeon or a dermatologist or plastic surgeon, somebody who deals with this a little bit more and can give you some more targeted help when skincare.
Pause, question. So you know how, okay, you named 2. You named a brightener in, hydroquinone and retinol, which does all sorts of things.
Right.
I think, tell me if I'm wrong, some of the stuff you can buy in the department store at this point has reached the level of efficacy of prescription. However, they are not able to claim that or test for that because then it would be a drug. So you really are getting pretty good level stuff and non-prescription. Do you agree or disagree?
Yes and no, because it has to do with concentrations.
Okay, and you might not know because
Right.
they don't have to disclose because they're not a drug. So
Correct.
you're saying with the drugs at least, I'm getting an insurance policy that I know exactly what is in there.
It's a little bit more potent and efficacious. For example, like I'll just use sunspots as an example. Those are really hard to address. And so over the counter, you might get a product that has 2% hydroquinone. Prescription-based starts at 4%. A lot of times patients need 6 or 10% sometimes.
Yeah, I'm not talking about the same ingredients though, but they might have found, let's just say they found a kojic niacinamide complex that did it just as well.
Sure. We are very sophisticated with skincare. Don't get me wrong. We are very sophisticated. And so what you're saying is they may have found an alternative that kind of addresses the same thing. So like licorice,
I'm not saying, by the way, guys,
acid.
that I found that. And in fact, brightening spots and hydroquinone is probably the place where that isn't the case. But I'm hypothetically.
I would say that skincare is very sophisticated right now. And we are achieving levels of advanced skincare that we have not seen in the past.
Dr. Lee.
But it's not enough.
What do you use? Okay, so you know this. You have prescriptions, you have all of that. Like, what are you doing?
So
If you don't mind
I
sharing.
don't mind. I will share for your listeners, of course.
Exclusive content.
Exclusive. Okay, so I tend to have dry skin. And I'll share this with you. I've always had really dry skin, even when I was younger. I didn't really have oily or combination skin. And I went to Stanford Medical School, and right on campus, we have a really high-end shopping center right there, right next to the medical school. So every weekend, I was at Neiman Marcus testing out every skincare known to man. And I was like, I still feel dry. I still feel dry. I would use these samples of super high-end skincare lines that you would think would really be efficacious. And I'm like, I'm still dry. I'm still dry. I don't understand what is going on. And so it has taken me a really long time, but I found a moisturizer that isn't too heavy for me, but keeps me well moisturized. And that's the one that I use. It's by Luzerne. It's called the Intensive Cream. And it's something that I use morning and night because it has the ability to keep me not so dry, but it's not so heavy where I feel like I've caked on stuff. And it's a really hard balance to kind of find that product.
And that's just your moisture. That's not even an active targeted thing for any anti-aging purpose or whatever.
No, I mean, it definitely has like bio-Swiss ingredients. It's a high end. You can only find it in certain really high end doctor's offices or spas, but it's a little bit more of a niche product.
And you would tell me if Amlactin or CeraVe or Cetaphil was as good, right?
Right. I would tell you. I've used all those products.
Okay. So you get what you pay for with the Luzerne. That's good. What else do you use?
I also really recommend using an exfoliator. So there is one that I really like. It's by a company called Definage. It's called a 2-minute mask. And so here's the thing. When you do what I do, every day I get people knocking down my door going, oh, we'd love for you to carry our skincare. And I, as a consumer, as a female, that to me, you can't just tell me something feels great, smells great. I'm not going to buy that. I vet things out. Primarily because I'm female, but primarily because I love skincare and I do what I do. So I will take the product and I will test it out for several weeks, and that's all I'm going to use to see how it works. And so Definage has a lot of science behind it. And what I did is I would do one half of my face using the product, and I would not use the product on the other side, and I would kind of repeat this over and over again. And it's amazing. I mean, you'll see the difference right away in half the face. So it really helps to exfoliate. I think that the science behind it, the company is driven by science and it's driven by a PhD. And so it's not just about this feels great, smells great. Because I think we're past the feels great, smells great consumer at this point.
Yeah. Okay, so a Definage exfoliator.
I think one other thing I would also recommend is something called the hydrofacial, which many of your listeners may be familiar with. The hydrofacial is this amazing treatment that I recommend doing once a month, where it comes in, it cleanses, exfoliates, it kind of really takes care of your skin health, and it infuses some super serums and antioxidants. At the end of the treatment, and this is the only part that I'm kind of like, don't ever show mine to anyone. But at the end, they'll show you all the dead cells that they've sucked out using that vortex fusion technology. And you see it in the kind of the waste container. And I'm like, okay, do not show that to anyone else. Like, please do not, because it's very satisfying. And you don't realize how much gunk you have in your face until you actually have one of these treatments and you actually visually see it, because it is shocking. And this is why it's such a great treatment.
You could get that at spas now too, not just doctor's offices, right?
You can. It's a little bit different in that some of the products that are used in the treatment, there's an MD line and then there's like a spa line.
Right, because as it's vacuuming and it's also infusing, and so there might be a slight difference, but you like
There's
that.
a difference.
That's good to know, because
Yes.
sometimes I feel like a lot of doctors are dismissive of those types of procedures, but it's good to hear that you're like, no, it does something.
I love it. I mean, remember, I'm a girl.
Did you
I'm
buy
female,
one for your
so
office? Does your practice have one?
We have 2.
Do you do yourself or does somebody do you?
I've tried. So I bought the second machine because I really just wanted to bring it home and use it on myself. That was the real reason why I bought the second machine.
That is hardcore.
But my staff tells me that I can't do that they have to keep it in the office because they need it.
It's got to get calibrated. They got to clean it. Come on.
So
I think about that though. Do you guys is there like at home like a little Fraxel like tucked in the corner of the old one?
that was the purpose of this. I bought another machine and I said, I'm just going to buy this for my own personal use, guys. And now it's still sitting in the office. And I'm like the shoemaker's kid. I never get to do it because, right, that's what happens. And so we're too busy. But I tell them, like, guys, this was really supposed to be for me at home. So we have the hydrofacials, we have the Casey machines, and those are things that we have in the office.
What's the Casey machine? And then I'll let you go. I know you have patience.
The Casey machine is kind of a unique machine. It uses a slightly different type of technology to try to, in layman's terms, try to retrain the muscles so that they're more lifted. So this is kind of a unique category of your non-surgical facelift. But the challenge with it is you need lots of patience. Remember when I told you something's non-invasive, you need more patience. But it's thought to retrain some of the muscles so that they stay more lifted.
With like an electrostimulation kind of thing?
Kind of, something like that. Similar to that. So back in the day, a lot of celebrities had their own sort of personal ones at home and were using it. This is why I purchased this for my own use, and it's sitting in the office because my staff won't let me bring it home.
But the patience meaning it's the kind of thing, it'll work, but you have to keep doing it.
That's right.
Over time. Okay, I hear what you're saying.
That's exactly right.
Okay. This has been enlightening. I can't let you go without doing Fat Mascara 5. It'll be speedy. What was the first beauty product you ever remember liking or using or loving?
Okay, so this is kind of going back a little bit, but it was probably, and if I tell you this, it's gonna put an image in your mind. It's probably just classic pink lip gloss, right? When you were a kid, it just makes your lips shine.
Come on, is it Tinkerbell, Bonnie Bell, the rollerball? Come on.
I can't even remember but I would say like there's Juicy Tubes, right?
Okay.
Those were cute. And it just makes your lips look a little shiny, a little bit moisturized. And it was just the right amount of sparkle without going too over the top.
I'm going to say Juicy Tubes.
Yeah, I'm going to say Juicy Tubes.
That's a classic. All right. What piece of art, whatever that means to you, will you never be bored by?
So when I was younger, one of the books that I really enjoyed reading was The Joylet Club by Amy Tan. And I'm not Chinese, but it really talks about the themes of empathy, family, personal growth, and really some of the struggles and triumphs that come with generational and cultural challenges. So I think that was so empowering when they talked about the different families and the women in those families and trying to get those personal growth and triumphs in life.
Side note, I'm reading her backyard birding journals right now. She's a delight.
She's an amazing writer. Amazing.
Who is your fantasy podcast interview subject, if you ever had a podcast, or like just dinner date, if,
Assuming I could pick somebody who's not currently alive.
I'll allow it.
My fantasy interview would probably be Marie Curie. She was the first woman to win the Nobel Prize and the only person to win Nobel Prizes in 2 different scientific fields. So I think she's just absolutely extraordinary. She was a pioneer for women in science, and the impact of her work just really had a huge impact on the world. So I think it would be incredible to be able to have the opportunity to meet with her and talk with her.
I should rearrange the order of these questions because now the next question is what's your favorite snack? Which is kind of a letdown for Marie Curie, but okay. What's your favorite snack?
It's still a great question.
Yeah.
I really like just something simple, like a bowl of Greek yogurt with fresh berries.
Oh,
and
Dr.
a little bit of chia seeds.
Anything more indulgent you could tell us?
No, I try to stay away from indulgent, but I like that. And then I really like juicing. So celery juice is my new kind of go-to thing.
I always say juicing is indulgent because the amount of produce you need to get a good glass of juice is quite indulgent.
It's a lot more than you think, right?
Yes. All right. So it's your day off, whatever day that is for you. It's 11 a.m. What would you be doing?
So I would say that I'm probably doing something fun with my kids and turning our time together into something that's a fun learning adventure. So it might be exploring nature, doing a science experiment, or doing some sort of educational game just to spark their curiosity. And that's the way it's a good way to sort of blend activity with learning and make the most of our time together.
Oh, I bet that I would have loved that. So that sounds delightful to me. This has been so enlightening. I know it's going to bring up a lot more questions for other people, so I might be emailing you for more follow-ups, but thank you so much for coming on Fat Mascara.
We hope you enjoyed the show.
It's your reviews and feedback that help us make the podcast even better. Head over to iTunes to rate and review us, or email your thoughts to info@fatmascara.com.
We also want to answer your beauty questions and hear what products you love. To share a Razor One product review or to ask a beauty question, email us at info@fatmascara.
If you send it as a voice memo file, we can even share your voice on the podcast. You can also do that by leaving us a voice message. Our phone number in the United States is 646-481-8182.
Thanks so much for listening.